Good evening, everybody. My name is Shayla Dirksen, and I'll be the moderator for this debate. The topic of our debate is it ethical to require that registered nurses receive an annual influenza immunization? We have Yusun and Jenna for the affirmative, and Shelby and Samantha for the negative. According to Cynthia, 2009, the flu kills about 36,000 people, hospitalizes 200,000, and costs billions of dollars each year. Hospital Employee Health claims that the flu shot is very effective for ages 10 to 49. Hospital Infection Control and Prevention says that it is important for nurses to protect patients who are vulnerable because of their decreased immune systems. Hardy-Goddard, 2009, says that the flu shot is refused because of personal, religious, or conscious reasons. And the question is it effective? Murray, 2010, says there are other ways to keep a healthy immune system, such as lifestyle, relaxing, vitamins, etc. Also, other measures nurses can take to prevent transmission of influenza are there, and sometimes they could be more effective because they're guarding against other things. Otenberg, 2011, asks how they can develop a vaccine every year that is trustworthy. So for this debate, we will start with the affirmative side. You will have 5 minutes to present her case, and then Jenna will also have 5 minutes. We will then hear from the negative side. We will start with Shelby and then Sam for 5 minutes each. Following this, we will have a 10-minute break for each side to prepare the rebuttal, and then the rebuttal will take place. Everybody good with that?
Yep.
Yeah. Go ahead, Yusun.
Hello, my name is Yusun. I'm prone to flu shot. According to my research, Harvard Heart Letter in 2009, the flu can harm the heart. Like the flu is similar to another infections which affect the heart and circulatory system. It can make breathing difficulty, boost blood pressure, make it heart beat faster, and infection can also harm to coronary artery. A number of studies have linked flu with cardiovascular problems such as heart attack or cardiovascular related to death. The Center for Disease Control and Prevention claims a vaccination is either shot or mixed form is the best tool to prevent the spread of the flu and the flu-related complications, and further recommends individuals receive both seasonal flu and H1N1 flu shot. The healthcare workers should not delay in getting their flu shots because they are in front of line of fighting disease and preventing the public health. Healthcare workers are on the risk of exposure to the flu both in general community and the workplace. Healthcare workers should be vaccinated for two important reasons. The first one is to reduce the occupational risk of flu infection and prevent transmission of the flu virus to patients at risk of secondary complications and death. However, according to the research report, the flu vaccination rates for healthcare workers on a worldwide basis range between just 2.1% to 82%, so it's quite low. In 2007, only 41.8% of healthcare workers vaccinated during the flu season. And according to the article, up to 25% of non-immunized healthcare workers suffer from the flu during the winter months, and the infection rates may be higher if healthcare workers are asymptomatic. And healthcare workers typically need to have a high level of commitment to their patients. They will often continue to take care of the patients despite being infected with the flu, whenever knowing or not. The Canadian National Advisory Committee on Immunization considers the flu shot to be an essential component of standard of care for protection of a patient and expressively state that in the absence of contraindications, Canadian healthcare workers who refuse to flu shot impliedly fail their duty of care to the patient. The most unions do not oppose vaccination. They do oppose mandatory a program in which employee could be fired or non-competence. So the purpose of hospital and the healthcare organization is to strive for 100% voluntary participation of the flu vaccination. And that's all the information I have. Thank you.
I'm Jenna, and I am also pro-mandatory flu shots. According to the hospital employee health, the flu vaccine is very effective for older children and adults, generally ages from 10 to 49 years old. A single dose of an influenza vaccine is capable of preventing over half of medical care visits associated with influenza virus infection, which is a very large amount, and the influenza vaccines are very effective for those ages 10 to 49 years once again. And according to the Hospital Infection Control and Prevention, everyone who comes into contact with the person who is infected with the flu virus or carrying the flu virus would be benefited, and the cost is insignificant compared to a human life. Anyone with a compromised immune system, such as children, elderly, and even students who are run down with stress, are susceptible. Everyone is susceptible to acquiring the flu, although there is a population who are even more immune compromised who would benefit. While the resources needed to implement a mandatory policy are significant, especially in terms of financial and personnel resources, the benefits of protecting vulnerable patients and reducing employee illness and absenteeism far outweigh the costs. Healthcare workers can and do transmit influenza to vulnerable patients, leading to illness, deaths, and nosocomial outbreaks. Children who have cancer and are getting chemotherapy, children with neurologic diseases that are getting suppressant therapy, or children on steroids for their asthma. They're vulnerable. They can't be vaccinated. They depend on the population around them to protect them. And I think that those children are our responsibility. It is an irresponsible act on the part of healthcare workers not to get a vaccine. The flu vaccine is made highly accessible and free for healthcare providers and free for the general public. The flu vaccine is a patient safety tool which is ethically, scientifically, and financially compelling. People do not have the intention or principle to spread the flu virus, but intentions and principles do not protect the patients. Action is needed. The fact of the matter is that people die of this virus, and there is a vaccine that can safely prevent it.
Okay, thank you. Go ahead, Shelby.
Okay, so my name's Shelby and I'm against the mandatory flu shots. Michael Murray described some of the steps that we can boost our immune system so we don't need a flu shot and also so we can not have the flu. Some of these included a healthy lifestyle, which is essential for immunity. And this just includes eating a healthy diet, getting exercise, avoiding toxins and maintaining appropriate body weight, and getting enough sleep. Stress lowers immunity, so if you practice relaxation techniques such as breathing exercises, visualizations, or meditation. Also avoiding refined sugars and saturated fats, but making sure you get plenty of quality protein and essential fatty acids. Taking high quality vitamin and mineral supplements, vitamin B complex, vitamin C, vitamin E, zinc, selenium are especially important. Boosting your vitamin D levels, and taking a clinically proven immune enhancing product. Barbara Golder discussed in individuals refusing to get the flu shot. Some individuals balk at flu vaccination for personal, religious, or conscientious reasons, concerned that the complications associated with vaccine may be significant enough to warrant caution. This is remembering the epidemic of Guillain-Barré syndrome that followed inoculations for swine